Joining us today is Aidan O'Leary of the World Health Organization and Melissa Corkum of UNICEF.
And Dr. Omotayo Bolu, Chief of the Polio Eradication Branch of the Global Immunization Division at the U.S. Centers for Disease Control and Prevention.
Aidan, a lot of your work now is in Pakistan, and you talk about all of the different issues that they face there. Afghanistan also is the other of the last two countries that have not been able to eradicate the wild polio virus. How do you tackle all of those many, many issues that these people face when it all comes down to each single child?
So I guess when we look at Afghanistan, when we saw the transition in August 2021, the overarching priority for the program was to reduce an estimated 3.5 million children, which were essentially inaccessible to the program. What we've seen over the last 12, 18, 24 months is a situation where that number has reduced from more than 3.5 million to probably around 300, 350,000, largely concentrated in the south of the country. So I think we've made good progress, and we continue to make inroads in terms of our reach to populations, noting that this is not just through campaigns, it's also through health camps, it's through collaboration with other humanitarian partners, it's through every means that we can to try and make sure we can vaccinate and protect children. We did have a very specific challenge in the east of the country, which has been the source of most of the detections that have been recorded. So this is in the province of Nangarhar. And what we've essentially seen over the last 6-9 months is the program quality. And when we speak to program quality, we're basically reaching all the children that we need to reach to make sure that they're vaccinated and thereby protected. So we've seen the quality of our programs continue to improve to a point where actually in August of this year, for the first time in probably kind of 12 to 15 months, we have not been able to detect the wild polio virus anywhere on the territory of Afghanistan. We're not out of the woods by any manner of means. What's going to be really important is we maintain and intensify the momentum that we currently have to, again, continue to work to make sure that our children are protected. We're also, where this is feasible, working to try and strengthen the reach with other antigens. So it's not just a challenge for polio. There's been challenges with measles in the past and other diseases. And, where kind of feasible and where we can basically, kind of effectively collaborate, we're also working to try and strengthen the delivery of these other antigens to try and make sure that we build, the immunity of children who are the most at risk to the maximum extent that we can.
Dr. Omotayo, what do you think needs to be done to finish the job in Afghanistan and Pakistan? How do you see the way forward in those two countries?
We have to look at what the issues are. One is insecurity. Two is just the difficulty of accessing every child. And three would be the political will. One thing that's happening between Afghanistan and Pakistan is we see it as an epi-block. What I mean by that is because they are so closely linked together, and we're constantly finding the virus in Afghanistan, in Pakistan, and vice versa, we would like to treat them as one group. And so synchronized campaigns, meaning when we do a campaign in Afghanistan, we're doing the same in Pakistan, is one of the key things we need to ensure we're doing. So that when we are reaching children in one area, we're reaching them at the other side, and there's no cross transmission because we did not do a full coverage of the campaigns. The second is the insecurity, working with whatever insecurity we're dealing with, advocating with the leadership to ensure that we can use community members, we can use whoever is available to use to address the polio, because polio does not recognize which group you're in. It just recognizes a child. and we need to reach every child with a vaccine. And so dealing with the insecurity like we did in Nigeria, working with the vigilantes, working with the military, using community informants, people that actually live in the communities of insurgency, working with them to help give the vaccines will be important. But more importantly is making sure we're able to do house-to-house campaigns as well, advocating using the best approaches we know how to advocate through, getting the buy-in, and vaccinating door to door with whatever means we can is going to be critical. And the biggest thing I've seen Rotary do, both in Nigeria and since moving back here, is the ability of Rotary to advocate and mobilize resources from the program. That is why it's so critical that even when we stop seeing polio cases, we continue to ensure that surveillance is sustained, is strengthened, is followed up on, so that if we do identify a case or we see polio in sewage water, we can quickly respond.
Melissa, we have heard that there were outbreaks, I think, last year, New York, maybe London, I think, of the circulating variant polio virus in polio-free countries. So how is this different from the wild polio virus, and how do you stop that?
We are, facing outbreaks until we finish polio globally. We're going to continue to face outbreaks, and the variant occurs when a weakened strain of the polio virus in the vaccine circulates amongst under-immunized populations for a period of time. And so in those areas where we don't have, we're missing kids and we have under-immunized kids, this is where we continue to face challenges with outbreaks. But the tools are the same. It's the same approach to putting an end to a variant outbreak as we are doing in the countries with wild polio virus. Getting drops into the mouths of the kids as quickly as possible is how we achieve success. Doing it quickly and raising the alarms in countries where they haven't had polio for a long period of time, like New York, like the Londons, to make it a priority amongst everything else, and to a forgotten virus is one of the big challenges. And that's quite different from Pakistan, Afghanistan, the endemics, which have had polio around for a while. So raising the alarm, sending in the fire department, so to speak, with the rapid responders becomes so critical in places where we're having outbreaks.
It's probably difficult to say that despite all of the progress that's been made in the eradication effort, that you're close. Can you say that yet?
I think we are close. Polio is cornered in just a handful of geographies, not even countries, small pockets of geographies, districts, 3 provinces in Eastern DRC, 4 states in northern Nigeria, small districts in Khyber Pakhtunkhwa of Pakistan. It's never been so geographically cornered. So I think there is tremendous progress. It's not just about the numbers of cases. It's the fact that it's cornered in really, really small places with, actually very few children. So in the wider scheme. So I think we've never been this close before, but that progress is incredibly fragile when you consider the geographies, the countries where we are fighting this battle. It's, polio amongst, wider public health emergencies, humanitarian contexts. It's the DRCs, it's the Nigerias, it's Afghanistan's, in the much wider geopolitical space. It's, these are challenging places to be working in. So that progress is real, but it's very fragile. And I think that, we need to have laser focus on reaching all children in those handful of places towards the goal.
Thanks to all of our guests for updating us on the state of polio eradication. To learn more about Rotary's polio eradication efforts, visit endpolio.org.